Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Model Paper 1 for the AAPC CPC Examination. I will share quick techniques to find answers very easily, along with the detailed explanation to help you to understand the key concepts.
Chapter 14, Pathology and Laboratory Codes. There are 6 questions. This section will test your knowledge of organ and disease panels, drug testing, therapeutic drug assays, evacuation or subtraction testing, consultation, urine analysis, molecular pathology, MAAA, chemistry, hematology and coagulation, immunology, transfusions, microbiology, anatomic pathology, cytopathology, cytogenic studies, surgical pathology in vivo, and reproductive. So let's go for the first question. For a routine gynecological exam, a pap smear is obtained from the cervix of a 42-year-old female. The screening is conducted using an automated system with provider oversight. What CPT code is appropriate for this service? So there are 488,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this question you have to highlight this is a routine gynecological examination. Here the pap smear is obtained for screening using automated system with provider oversight. So when you see the codes, all are 88,000 codes and adjacent codes are available. So you can use the elimination method to find the answer. So let's go directly to the codes. When you go to the code 88,164 is cytopathology slides cervical or vagina. It's a manual screening under physician supervision. So here manual, but in our case it is automated system with the provider oversight. So this code is not suitable. 174 is cytopathology cervical or vagina. Any reporting system collected in preservative fluid, automated thin layer preparation, screening by automated system under physician supervision. In this case, the pap smear specimen is prepared by automated thin layer preparation. But in our case, it is not mentioned. Normally, it is made by manually. But 174 says it is automated thin layer preparation. So that is also not suitable. When you see other codes, 88,147, that is cytopathology smears, cervical or vaginal, screening by automated system under physician supervision. So here you can see this is cytology smear. So pap smear or here cytology smear, cervical or vaginal, purposes screening, automated plus physician supervision. All the explanations are exactly matching the case. So the correct answer should be 88,147. If you see other code 148, screening by automated system with manual rescreening under physician supervision. So in this case, only automated plus physician supervision, but this case automated and manual. So that code also not suitable. So the correct answer is answer C, 88,147. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, first go to the code cervical smears. So this is a pap smear, so go for the cervical smear. Again, you have to go to the subcategory of cytopathology. Then go to the subcategory of partially automated screen. So it will lead you to the following two codes, 88,147 and 148. Again, go back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be C. Question number 2. A patient was brought to the emergency department following a car accident, suspecting the patient had been drinking and driving. The physician ordered a alcohol pathology test. After determining that the patient did indeed have alcohol in their system, the physician then ordered a pathology test to check the amount of alcohol in the bloodstream. So here you have to find the answers to the both dashes. So there are 4 answers: qualitative and quantitative, pathological and cytopathological. So please pause the video and think the answer.
3, 2, 1.
Okay, here the correct answer is the first one is qualitative, second one is quantitative. In this case, suspecting that the person had been drinking and driving, the physician ordered a qualitative alcohol pathology test. After determining that the patient did indeed have the alcohol in their system, the physician then ordered the quantitative pathology to test the amount of alcohol in the bloodstream. A qualitative pathology checks only for presence of specific substance, in this case alcohol. After the qualitative results come in positive, a quantitative test checks for the actual amount of substance in the bloodstream. Question number 3. During the surgical session, the pathologist received and performed analysis on 3 separate biopsies from vaginal wall and 1 from the cervix. How should the surgical pathologist code for these surveys? So there are 4 answers. All answers are similar answers, 88,355 and 307. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight pathologist received and performed analysis on 3 separate biopsies from the vaginal wall and 1 from cervix. So altogether, 4 samples are received. So if you see the codes, all 4 answers having the 88,305 and 2 answers having 88,307 with multiples are also available. So you can use the elimination method to find the answer. So directly go to the codes. When you go to the code, this is in the surgical pathology. So there are 5 categories you have to go through and find the answers. So I'll show you in the real time. So when you go to your CPT code book, it will appear like this. It will say the surgical pathology. 88,300 is 11.1. That is surgical pathology, gross examination only. But in our case, it is a microscopic. 88,302, you can see level 2 surgical pathology, gross and microscopic examination. So you have to find the answers in this course. So in our question, we are doing the biopsy on cervix and the vagina. So you have to search for the vagina. Here you can see vaginal mucosa. So that is not suitable. Go down, other course 304. Here also you have to check whether those that is listed here. Those are listed in alphabetic order, so you can check easily. 88,305, that is level 4 surgical pathology, gross and microscopic examination. So here you can see cervix biopsy. So cervix biopsies are available here. And also if you go down, you can see vagina biopsy also available here. If it is not listed here, you can go to the other code 88,307. So in this case, the both codes, cervix biopsy and vagina biopsy included in the level 4 code, that is 88,305. So let's come to the question. So here you can see both the codes are available in the 88,305, cervix biopsy and vagina biopsy available. So the question you can see, the perform 3 separate biopsies from the vaginal wall and 1 from the cervix. So there are altogether 4 samples. All the 4 samples are included in the code 88,305. So you have to multiply this 88,305 into 4. So the correct answer is C. If you find this question in a real working scenario, you have to go with the CPT alphabetic index. So in the CPT alphabetic index, first you have to search for the surgical pathology, then go for the subcategory gross and microscopic examination. Here it will lead you to all the 6 levels, level 1 to level 6. Again, you have to go back to the tabular list and confirm the answer. Once you confirm, all the codes are included in the level 4, that is 88,305. 4 samples are received, so you have to multiply it by 4. So the correct answer is C. Question number 4. A patient with acute asthma exacerbation underwent spirometry. Albuterol 1 mg was administered by a nebulizer, followed by repeat spirometry. Post bronchodilator studies with 2 of 3 attempts successful revealed an obstructive pattern and partial resolution of wheezing, but continued restricted airflow. What is the appropriate CPT code for this pulmonary function testing? So there are 4 codes available, 94,010, 12, 60 and 70. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, we had to highlight the following things. This is acute asthma exacerbation, underwent spirometry. There is a drug given by a nebulizer, followed by repeat spirometry. Post-bronchodilator studies with 2 of 3 attempts successful. Finally, the partial resolution of wheezing, but continued restricted airflow is there. So when you see the answers, all answers are adjacent answers of 94,000, 10, 12, 60 and 70. So you can use the elimination method. So directly go to the codes and find the answer. So when you directly go to the code 94,010, that is spirometry including graphic record, total and tight vital capacity, expiratory flow rate measurement with or without maximal voluntary ventilation. So here it is not mentioning any drug given or the final output, that is a continued restriction airflow, not mentioned here. So when you go to the second code 94012, measurement of spirometric force expiratory flows before and after bronchodilator in an infant or child through 2 years of age. So here this says in an infant or child through 2 years of age, but in this case the age is not mentioned, so we can't take it as the infant. So let's go to the next code 94060, bronchodilation responsiveness spirometry as in 94010. So 94010 is this one. So this 94060 include the 94010 as well. So pre and post bronchodilator administration. So this is exactly matching the scenario. So this include the code 94010. So you have to take both as one code. So the correct answer should be C, that is 94060. So if you encounter this case in a real working scenario, you have to go with the alphabetic index. When you go to the CPT alphabetic index, the only code available is spirometry. When you go to the spirometry, it will lead you to the following code series. Again, you have to come back to the tabular list and confirm the answer. Once you confirm the answer, the correct answer will be C. Question number 5. A comprehensive metabolic panel and a general health panel is ordered and performed on a patient. What is the correct CPT coding for these laboratory orders? So you can see there are 80,000 codes available. So please pause the video, take your CPT code books and find the answer.
3, 2, 1.
In this case, you have to highlight this is comprehensive metabolic panel and general health panel. When you see the answer, all the codes are adjacent codes. You can see 80,000, 53, 50, 51 and 48. So you can use the elimination method. So directly go to the code and find the answer. When you go to the code, you can see 80,048, that is metabolic panel, calcium total. So in our case, comprehensive metabolic panel and general health panel. So that is one part is available here. When you take 80,050, that is general health panel. So one part is here. This panel must include the following: comprehensive metabolic panel. So this 80,050 include the comprehensive metabolic panel plus general health panel. So the one code itself denoting the scenario here. So no need for the additional code. So you can select this 80,050, that is answer B, as a single code. In this code, the general health panel, this panel must include the following, that is comprehensive metabolic panel. So the comprehensive metabolic panel and general health panel both are included in the code 80,050. So the correct answer is B. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, first search for the term panel. So go to the panel, then go to the subcategory organ or disease oriented panel. There you will get the following three lists. One is basic metabolite, then comprehensive metabolite, then general health. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be B. Question number 6. An established patient come in complaining of nausea and vomiting and states she has not had a menstrual period in over a month. A complete CBC and automated differential WBC is ordered. The provider also orders hepatitis B antigen, rubella, RPR, antibody screening, blood typing for Rh-NABO, and urine pregnancy test. What is the correct CPT coding for the laboratory testing? So there are 4 answers available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight. So if you are familiar with this kind of coding, you have to know this test, that is hepatitis B antigen, rubella, RPR, this kind of tests are pregnancy panel tests. So you can see the answers 80,055 and some other code series are used here. So you can use the elimination method to find the answer. So directly go to the code. So once you go to the code, you can see 80,055, that is obstetric panel. So this panel must include the following. So here blood count, complete CBC, automated and differential WBC. So that is the first test we have done. And the blood count, hepatitis B surface antigen, you can see hepatitis B surface antigen here. and the antibody for rubella, that is here. Then syphilis test, that is RPR, so that also mentioned here, and antibody screening, that's also here. Blood typing and ABO, blood typing RH, so those things done here. Blood typing for RH and ABO, so that is also included. So all the tests are included in one code except urine pregnancy test. So you can see there's no urine pregnancy test in this list. So for all other tests you can use one code, that is obstetric panel, but only exception is this urine pregnancy test is not included here. So if you go to the code 81025, that is urine pregnancy test by visual color comparison method, so that also included here. So 2 code is enough for this scenario, so that is 80,055 and 81,025. The correct answer is C. So if you encounter this case in a real working scenario, you had to go with the CPT alphabetic index. So in the CPT alphabetic index, you had to go to the blood test first, then go to the subcategory of panels, then go to the obstetric. So you will find the obstetric code. For the second part of the code, that is urine pregnancy test, you have to go to the urine analysis, then go to the subcategory pregnancy test. It will lead you to the code 81,025. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer C.
So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.